Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello, and welcome to Bristol Health Cares. I have an exciting episode today. I'm here with Dr. Rupalini Dhingra. Dr. Dhingra, it's wonderful to have you this morning. Why don't you tell this audience about yourself?
Hello, Kurt. Thank you so much for having me and bringing me to the show. And so I'm one of the OBGYN physicians with Bristol Health. I have been with Bristol Health for the last 7 years. I think it is one of the most exciting part of my career. And I am one of the 4 OBGYN physicians with the Bristol Health Medical Group. And we have our office locations in Bristol, Plainville, Southington, and New Britain. The other twist to my career at Bristol Health is to serve as the chair of Bristol Health Medical Group Board of Directors. And it brings a little different taste to my platter, but I'm loving it, and I love my journey here.
That's awesome, and it's exciting, and it's really amazing to hear how many things you do and how easy you make it look often to me. I mean, I'm startled by that. You're also on the board of directors of the hospital too as well. So just incredible engagement and leadership, and I think everyone in the organization appreciates that. So you said one of the most exciting decisions you made. Tell me why. What's different about Bristol Health?
So it's funny you asked me this question, because if I tell you the truth, when back in 2015, my husband, who works as a pediatric hospitalist at Bristol Health, he sent my CV without asking me when there was an opening. Yes, when there was an opening at Bristol Health. And after the fact, he told me that there was an opening and I forwarded your CV. At the moment, I wasn't looking for a change, but when I was called for the interview, I really liked the place, the people, the colleagues. Everybody was very welcoming, and that was the moment I signed up and never looked back. And I think, as I said, one of the best decisions I made. So I'm very happy to be here and part of the team.
I think he had an ulterior motive, because I see you sometimes having dinner and lunch together, and I guess you, with your schedules being so busy,
yes,
he really wanted to be closer to you. I'm sure that was part of it.
I think that cup of coffee that we have in the mornings really serves the purpose.
That's awesome. That's really awesome. So tell me a little bit about your practice, your OBGYN practice, and the range of things you do, because I think it's incredible. It's very, very broad what you actually take care of.
So OBGYN, I think it stands for obstetrics and gynecology. I think it brings the mix of both primary care and surgical field. And the most gratifying part of our profession is the satisfaction and the gratification we get after delivery and bringing a life to this world. When I was applying for OBGYN residency, it is a hard decision to make, but the mix of the primary care and the surgical specialty it was bringing, that was a no-brainer. I just wanted to do the mix of both, and I think that was the reason I chose this field. And to tell you the truth, from primary care physicians, we offer, when we see patients from all age ranges. We see adolescent, we see menopausal patients. So the spectrum of patients that we see is amazing. I think the other specialties may be lacking that, but I think I enjoy when I see my 12-year-old with menstrual problems, or I see my 80-year-olds with vaginal dryness or menopausal symptoms. So I think the mix and the spectrum that we treat is amazing. With the surgical field, we do offer urinary incontinence procedures, and I do minimally invasive slings procedures, which are life-changing if you are suffering with stress urinary incontinence. We also offer minimally invasive gynecology procedures like robot-assisted hysterectomies, tubal ligations, ovarian cystectomies, you name it. So the minimally invasive part of the surgery, I think it helps the patients go back home within 23 hours of their surgery and with minimal pain. So I think these modalities, and Bristol Health is helping us achieve those modalities. I got robotic trained last year, and thanks to the Bristol Health, which supported my decision to get robot trained, and helped me accomplish that. So if I were to talk here for all we offer, you'll be amazed. We offer breast health, we offer menopausal treatments, menstrual problems, reproductive fertility issues. We do have a wide spectrum of patients who have hard time conceiving. And to see a reproductive specialist, it may take 6 months. So patients do get their basic workup from us, and we can help them take a jump start.
Yeah, that's so important. You know, it's one thing you were talking about that's often the focus of folks that are embarrassed by incontinence, a big issue. And and I've done some reading on that, and you hear that that patients are very uncomfortable talking about it. And it's one of the most untreated things and the most uncomfortable things. And, thinking about the viewing audience out there, what would you say to them? I mean, when they see their doctor, don't hold back. What's the advice? I mean,
so it's a very good question you ask, because believe it or not, 3 out of 10 women suffer from urinary incontinence, and only 1 out of that may bring it up to their OBGYN. So this is actually a teaching a situation for all the OBGYNs out there, that please ask the leading question. And it is part of our intake. When we bring our patients to the waiting room, we have our intake of questions or problems that they may be suffering with. And urinary incontinence is part of that intake. And because majority of the patients will not bring it up. So it is our duty to ask them this leading question. And on the similar subject, the sexual history, patients will not bring it up. And it needs that considerate OBGYN to bring it up and to start the conversation. And you'll be amazed how many patients will then be able to communicate it to you. And before we even offer surgical procedures for those, we have our Bristol Health pelvic therapist who can help them with Kegels exercises and actually focused pelvic therapy for the improvement of incontinence. So they don't even have to sign up for a surgery. So there's so many things we could do before. It's just a matter of bringing it up. So yes, I would encourage all OBGYNs that are listening to me to please make this as your intake questionnaire.
So it must be, as I think about you come to see your doctor, there has to be that feeling of trust, and it has to feel like it's private and you can disclose those things. Like, how do you create that feeling for your patients? I'm curious.
It's a very, very sensitive question for me, because behind those closed doors, I have heard so many stories, and so many of those affected by those stories that they don't share with even their husbands at times. So I feel like an important person in their life to be able to help them with those situations. As I mentioned, the sexual history is one of those. Majority of my patients just shut themselves down from their husbands and not even talk about it. by just discussing it with me, they are able to bring it back to their dining table or to their bedroom and to have that conversation with their husbands or their significant others. It gives me that honor to be able to help them with that. Even the younger population, if you come to that adolescent gynecology that we were talking about, majority of those patients are not comfortable talking to their parents about situations and things that may be happening at school. So I feel such an honor and pleasure to be part of their reproductive journey, that they could share those stories behind those closed doors. We do offer chaperones to all our patients if they felt, but majority of them don't end up choosing it because of the trust and the that they could share, and I will be able to help with their journey. So it's a privilege.
Yeah, it's. I mean, I think the key takeaway too is, if you don't tell your physician what's going on or how you feel, and there's nothing that could be, considered, stupid or, not right to disclose. It's really important to be very open and honest with your physician, and that relationship, like you said, is just so confidential and so important to being able to take care of somebody's needs. So talk a little bit about the birthing experience. I mean, your face lit up when you talked about why you got in, and the experience at Bristol Hospital, because I hear from so many people, that have had their kids. I mean, actually, we have a bunch of board members that were born at Bristol Hospital, and I hear it every time they talk. And I was born here, and the experience is, very unique and special. So what is it about that experience?
So I feel actually very proud to talk about our units, to talk about our Families Are First unit. Our hospital is Magnet recognized hospital, where we take pride in our nurses. We take pride in our nursing leadership and our nurses at every level. I'm very proud to state that, our Families Are First unit, which is our birthing unit, is one of the most incredible unit you can find in the neighborhood. I have been to many hospitals. And actually, I delivered my second baby at Bristol Hospital, delivered by one of my colleagues. And I have seen and experienced on both the ends as the giver and the recipient of the care. I take pride in our nursing because majority of our nurses are OB/RN trained nurses. Majority of them have fetal monitoring training, which requires hours and hours and hours of training that they go through to get certified for these things. And a lot of our nurses are lactational specialists. We have our first-time moms who struggle with their breastfeeding experience, and I can proudly tell my patients, don't worry, we got this. I have someone special every shift of the day that they can be helped with the breastfeeding. So I really take pride in our nursing, and I think that gives me the confidence to be able to continue my practice for my patients at Bristol Health. And yes, every delivery brings a tear to my eyes, even to this date. And the joy that is in that room is so palpable. Pre-COVID, we used to have a party in the room where generations of grandmas and great-grandmas and everybody would be there, which hopefully will go back to soon. But the joy is so much out there that it just, and the patients, the gratification that they show to our nurses, to our unit is amazing. So I'm really proud of our team and even all our OB doctors. I think we all do American College of OBGYN, which is our Bible, evidence-based practice. And again, it's very important to follow the same standard of care. We cannot deviate from it. And I can proudly say that all my colleagues I can trust blindly and leave my patients if need be, or have them deliver myself. So I'm really proud of that,
awesome.
our unit.
Yeah, it is. I have to be honest. I love when I get lost sometimes, you know, because sometimes sitting behind a desk and reading and doing things. And the nice thing about my job is I can just get up and walk and round on units. And I love going to Families Are First. I just absolutely love it because, you know, there's often babies in there and the staff is happy. And it's just a great warm feeling. And when I get off the elevator and I see the picture right there as you walk in, it's absolutely amazing to see. Yeah. And I think it's, you know, one of the attractions for me is we have a community hospital. So we do deliver babies. We do put smiles on faces. And amongst all the other things we do, I think that's one of the most important things. So I appreciate that. So you talked a little bit about, I'm going to shift gears a little bit on you, being the chair of Bristol Hospital Multi-Specialty Group. And I'm going back to when you were on the board and thinking about this, and then you jumped in and you did it, and you've done an amazing job. So talk a little bit about that group and why that's so important to the community.
So I was not expecting to be the chair that soon. That's the first thing. But, you know, serving on the Bristol Health Medical Group board itself was a big honor to me. And to be able to have that voice and to represent the physicians, which are stakeholders, and the patients, because I, you know, having that experience one-on-one with them, I can bring that to the table for Bristol Health Medical Group board, because what the patients expect, what the patients need, what their desires are, if I can bring that to the Bristol Health board, that is what I'm trying to achieve by sitting there. To have that voice for those patients. So yes, it is an exciting part of my journey, and I'm loving every second of it. We do, we do have great executive leadership group who listens to us, and thank you for that.
Absolutely.
Because without you, I don't think, you know, I would survive that chairwomanship, I should say, because it's very important to be heard. It's one thing to just speak, but if we are not heard, it goes to the waste. So I think to have that leadership like you and our president of our medical group, Chrisanne, I think that gives me that the team that we work as together. It makes me feel we are achieving things. We are able to strategize. We are able to bring different things to the table and work as a team to it. So thank you.
So the thing that strikes me the most, because I love going to meetings, so the board itself is a majority of it is employed physicians. So you have employees really running that part of the organization. One of the most important parts of the organization, right? And it feels like when I see the interactions, so often I'll get a picture on a Friday night where you're all out to dinner, having a good time, or at a restaurant, and it's not just OBGYNs. It's a diverse group of physicians. And I personally think that's exciting because everybody's so busy now. Everybody, two physicians, your husband and you are both physicians, you have kids you take care of, family, and it's hard to have that collaboration. And I think part of what's in the secret sauce is the fact that you spend time together in leadership on committees with a common purpose, which has developed into really amazing friendships. Absolutely. That's the best part I am loving about this being on the board is the team that we have developed, and all my fellow physicians who are on the board. As you said, we go out for dinners as families too. So we all have kids of the same age group. So we meet as families. But also, it's very interesting that, we are able to discuss our mutual patients and connect the dots. And we are able to, the other day, I was talking to Dr. Bloom, one of our cardiologists, about the women that need preconception counseling because they are at high risk now for cardiovascular mortality and morbidity
during pregnancy. So because of increasing obesity, increasing pre-existing hypertension, how as we, cardiology and OBGYN team, can come together and develop a program. If it wasn't for the friendship that I have nurtured through the board, I don't think we will be able to achieve this. So yes, there are a lot of more ideas that come, you know, as we meet, even if it's outside work, we come up with such great ideas, and with your help, I think we'll be able to achieve it.
It's so funny because you said Dr. Bloom, and the reason I was late last night was I was responding to one of his emails. I think you were copied on that as well. He keeps us on our toes.
Oh, yes.
I don't think he actually sleeps at all, but he's an amazing cardiologist. So, you know, and for me personally, what you just described, it's this quest to get that collaboration, because I think that collaboration makes this family feel real, but it also, as you pointed out in the end, it improves the outcomes for our patients. You know, OBGYNs, especially when you talk about the collaboration with endocrinology, you know, it's been around for forever, gestational diabetes, and how do you treat that? But there are all these other things that potentially could be improved on, and you get there because you have these relationships. I think that's amazing. It's totally amazing. And so, you know, go back a little bit to, you were talking about minimally invasive surgery. So I wanted to, I'm sorry I'm going backwards to that point, but I wonder if the audience really understands what that means. And you talked about robotics, and you know, could you in like common terms, because I'm sure you describe this all the time to folks, but could you go through that a little bit?
So, Kurt, as you can see, the name itself, minimally invasive gynecology surgery. Minimally invasive because back in olden days, the only option we had was to cut the belly open, either from, you know, belly button down to the pubic bone or sidewards, like a C-section incision. We have swayed away from it. We are able to achieve the same exact outcomes, even better outcomes, in gynecology procedures with just 3 small incisions, about 3 millimeters to 5 millimeters in size incisions. We make 3 in your belly. And when we put our camera in, we distend your abdomen with gas. So that gives me the exact view that I'm trying to achieve if I had my belly cut open. And then with the advancement in the tools that I could pass through, again, 5 millimeter incisions on your sides, I'm able to do your hysterectomies, remove difficult ovarian cyst. Patients who have endometriosis have very strong adhesions to their pelvis. We are able to dissect all these adhesions without having to cut open the patient. These patients benefit from these surgeries not just because they go home in one day. It's mainly because the blood loss is minimal. For these hysterectomies done through the advanced technologies, the blood loss is 50 to 100 ml on an average, whereas if you were to open those abdomens, we could lose up to 500 ml of blood. So able to reduce that blood loss, the need for blood transfusion, and the recovery. Of course, if you're anemic, your recovery is harder. So able to achieve all those. Then the rate of infection. If I have a bigger incision, then my rate of infection is much higher versus when I have a smaller incisions. Then again, the post-operative pain is absolutely big difference. My patients are walking in my office 5 days later after the surgery with their back straight open. Back 10, 15 years ago when we were doing the surgeries with the full incisions, patients would be scrunched over, holding their belly, helped with an assistant to walk into the post-operative, care. But now our patients are walking straight up.
Wow.
Our waiting people are like, you are done with your surgery or you're scheduled for your surgery? Like, that's how well they look. So I think this, as surgeons, we are able to keep up with the technology advancements, and being able to offer it to our patients is one of the gifts we have. And we should be able to do that and be able to keep up with the advancement in technology and bring it to our community. And if we are able to achieve that, that's our biggest blessing we have. And in the heart of our, Bristol, we have this technology. We have a robot that further reduces the operative time for the surgery and the blood loss. I do procedures, minimally invasive procedures on BMIs of 56, 60 who absolutely need the surgery, much more easily done with a robot-assisted minimally invasive way versus the traditional open hysterectomies, because obesity does increase the risk of morbidity during surgery. Yeah. So to be able to do that with small incisions, lesser operative time, able to ambulate early, decreased risk of deep vascular thrombosis, that's what we bring to our patients.
So listening to you, when you think about Bristol Health or Bristol Hospital and the range of technology and available treatments, we're really no different for just the vast majority of the things that you do than any of these tertiary care centers. You can get really good quality care, personalized care, in a evidence-based in a family environment, right in your backyard, which is, to me, that's what's so exciting about it, because I still believe, that all healthcare is local. People want to have it locally. They don't want to have to travel and not be there with their support structure. So it's an amazing organization, and we're blessed to have so many amazing physicians on our staff. So what do you think is next?
So our Families Are First unit is collaborating big time with the Parent to Birth Center in the heart of Bristol. We will be able to offer free birthing classes to our patients, and at a very, very reduced minimal cost to the patients who reside in Bristol. And if patients decide to deliver at Bristol Hospital, there's no cost involved with these birthing classes. I think this is great and amazing, especially for the first-time parents. They are lost. And if they are able to achieve those classes, have, how to perform resuscitation on a newborn when they go home, and to have the confidence of breastfeeding right in the heart of our own community, I think we are striving for the better to the best. And the best part, I think, which again I take pride in, is we don't stop. We are constantly moving, again, to achieve the best to our patients and bring it locally to them. We are also trying to get a lot more other certifications. We already have Blue Distinction Maternity certification for our unit, which is one of the best you can get in the maternity unit. And I think that we are doing great, and just to be able to keep moving and bringing the best to our patients, that's our next goal.
That's awesome. It seems like a lot's changed, because I remember my pre-birthing classes, and we didn't do CPR. We didn't practice CPR. So I was just thinking about the difference, and obviously I'm dating myself, but it's really exciting to hear that we just keep going, we keep progressing. So, so any last words, any thoughts about, we're almost out of time, and I just want to make sure I give you a chance to say anything at all you want to talk about.
So one thing I do want to mention is, as Kurt mentioned, that please bring up your questions to the OBGYN doctors. And my plea to the OBGYN listeners is, make this as part of your intake questionnaires, because there are some sensitive issues that patients need to address. And then if you are looking for a physician in the heart of your own community, you can reach out to the Bristol Health. Our reach out number is 1-8334 Bristol Health Docs, BHDOCS. So reach out to us, and we are here to help you. And again, it's an honor to be here and to have a conversation with you.
Thank you, Dr. Dhingra.
Thank you so much.
So thank you for joining us for this episode of Bristol Health Cares. I had said in the past that there's an email you can send your questions and ask about different topics that you want in the future. It's cares@bristolhospital.org. Again, that's cares@bristolhospital.org. I want to say a special thank you to Nutmeg TV for helping produce this program, and all those folks in the control room that have been helping me and coaching me along the way, along with the rest of our team. So have a wonderful day. Thank you so much for joining us, and I look forward to seeing you in our next episode.